Hey guys, I did my organ presentation on the rectum. So let's just get right into it. This is my CT of the rectum, and it just shows you where it is right here where the red arrow is. So the rectum is part of the lower gastrointestinal tract and is a continuation of the sigmoid colon and connects into the anus. The rectum follows the shape of the sacrum and ends in an expanded section called the rectal ampullae, where feces is stored and before it gets released into the anal canal. I have another picture just kind of seeing where it is, so you can see you have your bladder here, and then the prostate, and then your rectum is right here outlined in blue. The rectum connects with the sigmoid colon at the level of S3 and connects with the anal canal as it passes through the pelvic floor muscles. The rectum is located between the sigma and the anal canal. The average length of the human rectum is 12 centimeters, and its diameter can be compared to that of the sigmoid colon. However, it becomes larger near the anus, where it forms into the rectal ampullae. The key role of the rectal ampullae is to act as a temporary storage for feces. The expansion of the rectal walls causes the stretch receptors within the walls to stimulate the urge to eliminate waste. If that process is delayed, it may result in constipation. And when the storage site becomes full, the intertractile pressure causes the anal canal walls to dilate and expand, which then results in the feces entering the canal. For the lymphatic drainage part, here is this, and I'll kind of go over that too. So for this, what the green is the nodes that are along the inferior mesenteric artery, and then the black ones are the periorectal nodes, and then this right here is just kind of saying this is the pelvic lateral lymph nodes. So the dark blue, which is all right over here, is the nodes that are along the common iliac vessels, and then you have these ones right here, which are the dark green ones, are the internal iliac nodes, and the orange ones right here are the external iliac nodes, and then the blue ones that are right over here are the orbitor nodes. I just butchered that. And then the labeling as for the 1, 2s, and 3s. So 1 is the inferior mesenteric artery, and then 2 is, which is right here, is your superior rectal artery. 3 is your common iliac artery, and 4 is your external iliac artery. 5 is your internal iliac artery. 6 is your orbitor artery. And 7 is your middle rectal artery. 8 is your internal pedunal artery. And number 9 is your inferior rectal artery. So once again, there's that. For the lymphatic drainage follows the superior rectal vessels, which empty into the inferior mesenteric nodes. The lymphatic drainage of the middle and the lower rectum also occurs along the middle rectal vessels, ending in the internal iliac nodes. The lowest part of the rectum and the upper part of the anal canal share a plexus that drains into the lymphatics that go with the inferior rectal and internal pedunal blood vessels and ultimately drain into the internal iliac nodes. Carcinomas of the lower rectum or those extending into the anal canal may occasionally metastasize to superficial inguinal nodes by connections to efferent lymphatic drainage or draining into the lower anus. I found this picture, this image really, that I just kind of really liked. It kind of is talking about just some of the cancers, or one of the types of cancers that you can get for rectal or colorectal, which is what I'm going to talk about here in a little bit. Rectal cancer has spread, in this picture, has spread to other parts of the body, or it can before. And then right here, this little picture that's right here is for your, like, the metastatic cancer that's right here, and then these little lymphs, the lymph nodes that are right over here, are the cancer cells in the lymph system, and then these little things that look like fat right there are cancer cells in the blood, and then all right through here is the primary cancer. I just kind of found that a little bit interesting. It kind of goes over the nodes too, and then I found this one as well, which kind of gives you different types of cancers. So that is what I'm going to talk about next, is the colorectal cancers. So those are just a few of the different types. I'm not going to try to say them because I know I'm going to butcher them, but there's this picture again to show you a little bit more. So for cancer, a rectal exam may be done to diagnose certain diseases. Certain types of cancers may be diagnosed by performing an endoscopy in the rectum. Rectal cancers occur when cancerous cells develop in the tissue of the rectum. Although rectal cancer is a life-threatening disease, it is highly curable if it's found early in the stages. Colorectal cancer ranks as a major problem due to the late diagnosis. Therefore, regular checkups and screenings are very important. Colorectal cancer, which is cancer of the colon or the rectum, is the first leading cause of cancer-related deaths in the United States. More than 148,000 new cases of colorectal cancer are expected to be diagnosed this year, and more than 56,000 people will die from this disease. The most characteristic symptom of the advanced stages of carcinoma of the rectum is pain. And colorectal cancer, which affects men and women at equally frequent rates, develops from pancreas or precancerous growths called polyps. Removing these polyps is the most effective way to prevent the development of colorectal cancer. And then for the my little last image, I have this image that I kind of found too, and I just wanted to throw it in there. It just goes for colon cancer and rectal cancer, and it kind of speaks for itself. So for colon cancer, it's equally common in both genders. Radiation is not commonly used for it. It's easier surgical treatment for this one. And then for rectal cancer, it's more common in men, metastasizes more easily, it's more difficult to cure. And then for both of them, the incandescent rates are the same, the genetic makeup is the same, the risk factors are the same, and the symptoms are the same. So, and that is the end of my presentation.